All right, so we will start this lesson on language disorders. And technically, we can divide these language disorders into two major types. One would be developmental language disorders, right? Also, there is this other form which would be acquired language disorders, right? So, those are the main two types. So according to the design that I have used, I cannot capitalize this. But when you write it, you need to remember that it is capital A. Right, okay. So we will start with the developmental language disorders, as in first we will discuss the definitions of it, right? Yeah. So developmental language disorder is known as DLD as well. So it is a condition where a child has difficulty learning and using language without, I would say, any obvious reason, like hearing loss, or can be a non-neurological condition, right? And it can be present from early childhood. That means the language difficulties are apparent right from the start, affecting this process of language acquisition itself. So you cannot say that it is a loss of a skill. It is not a loss of a skill, but an initial struggle to acquire it, right? And also, if we consider exclusionary criteria, that means we need to remember. So when we diagnose DLD, a diagnosis of DLD requires that the language difficulties are not explained by other conditions, so not caused by other conditions, as you can see here: hearing loss, autism, intellectual disability, or brain injury, right? So again, DLD is a relatively common condition, so that would affect approximately about, I would say, 7% of children. And that makes it one of the most common neurodevelopmental conditions, right? And also, the difficulties are typically persistent and also often continue well into adolescence and adulthood, right? So that means they require ongoing support. So let me move to the next part. Key features, right? Yeah. So the challenges in DLD. So hereafter I'm going to use the term DLT. So the challenges manifest across various domains of language. One would be morphosyntax. Morphosyntax again refers to grammar. So that means there would be difficulty learning and using grammar rules like verb tense markers like ed for past tense, or plural markers like s. And also sentences, as in their sentences, the sentences that they use may be shorter or structurally simpler than those of their peers, their friends, right? And if we consider phonology and articulation, so while this is not a co-diagnostic feature, some children may also have co-occurring speech sound difficulties. And also semantics, vocabulary. There would be a notably limited vocabulary development, right? There would be a smaller range of words used and understood. And also there would be problems with word retrieval, right? So this is also known as anomia. So where the individual knows the word but struggles to access it quickly during conversation. And also receptive language, as in understanding, that can challenge understanding complex sentences, like sentences with embedded clauses or passive structures. And then also there can be trouble following multi-step directions, so understanding abstract language. And if we refer to the pragmatics, as in the use in context, there can be difficulties with narrative skills and storytelling. Imagine that a student like this is going to narrate a story, then there would be issues, right? Because narrating a story involves sequencing events, and also you need to stay throughout, right? Maintaining the topic, and then also you need to provide necessary context for the listener, then there would be difficulties, obviously. And then also expression and reception, right? Expression versus reception, to identify it more lucidly, I would say, right? So this disorder may affect expressive language. By expressive language, I'm referring to speaking and producing language. And receptive language means comprehension, right? So it can affect either expressive and receptive, as in one of them, or else both, right? Yeah. Then we will move to the next part. Types of DLD, right? So DLD is classified based on the primary area of difficulty. So the first one is expressive DLD. So the primary difficulty is with language production. That means the person's understanding of language in this context is relatively better than their ability to speak it or produce language, right? And then receptive DLD. The second one is, as in the primary difficulty there is with language comprehension, right? So this usually has kind of a more significant impact on learning and communication of a child. And then mixed DLD. So that means this type affects both expression and comprehension, and this is considered as the most common presentation of this DLD. And if we consider this impact across the lifespan, right? So the effects of DLD usually extend beyond the communication domain because it can result in significant academic difficulties, right? Specifically with the skills, as in skills built upon spoken language, likewise reading and writing, literacy. And also there can be social challenges in peer interactions, right? And also building relationships, right? Due to here, yes. Again, social communication challenges mean when you kind of, tend to build relationships among peers, right? And also can be with teachers, adults. They would find it difficult to initiate conversations, to understand all the social cares, right? And also vocational. So that means the persistence of DLD, it can lead to reduced educational and employment opportunities later in life, right? People don't like to employ people with DLD most of the time, right? And also, when you consider the emotional aspect, there's a potential for mental health impacts, right? Including higher risks of anxiety, depression, and also low esteem, which is very much understandable, right? And then, if we move to the next part, that means there we are going to talk about the next significant aspect, as in next significant variety, because up to now we were talking about developmental language disorders, right? But now we are going to talk about acquired language disorders. So first, if we are to define it, right? So acquired language disorders occur after an individual has developed normal language abilities, right? They result from damage to the brain. So if we are to define it, so they occur after normal development. That means the individual loses skills they once possessed. So that means this can result, I would say, from a variety of causes, primarily brain injury or else a neurological disease. So if we talk about the manifestation of it, so this injury or disease can affect language centers. So it can lead to impairment of previously intact language abilities, right? Yeah. So then if we talk about the main types of acquired disorders, so the predominant one that we are going to talk about is aphasia. So let me take it here. But here we are kind of again talking about aphasia. Yes. All right. Okay. So, this is a primary language disorder, again resulting from damage to the language dominant hemisphere of the brain, language dominant part of the brain, right? So, most commonly, this is caused by a stroke, right? But also can be a traumatic brain injury, tumor, or even an infection, right? And there are some subtypes that we have mentioned here. So, there is this subtype called Broca's aphasia and unfluent aphasia. So, this is characterized by severely impaired, effortful, and also slow speech production. That means you struggle to speak, you struggle to produce language. So, grammatical structure can be usually very poor, right? And also, language. comprehension can be intact, right? But grammatical structure can be very much poor. And then you have Wernicke's aphasia, so that is called fluent aphasia as well. So the speech is fluent, but it would be nonsensical and filled with incorrect or invented words like neologisms, not like the neologisms that we have learned, as in, like we talk about Shakespeare's neologisms and all, not like that, right? So here the main, I would say, defect would be severely poor comprehension, right? So, at the first part, you can say language comprehension is relatively intact. Here, language comprehension is very poor, and also the words would not make sense. And then you have like global aphasia, the most severe form that would result in severe impairment in all language areas. When I say all language areas, I'm referring to speaking, understanding, reading, and writing, all these, right? Yes, so let me elaborate on it in the slide as well, all these four, right? Yeah. And then if you consider anomic aphasia, so the co-symptom is a persistent and pervasive problem with word finding anomia, right? So fluency and comprehension are there, but it is difficult to find the proper words, right? So that is the idea there. And if we refer to the next part, traumatic brain injury, right? So language difficulties following this thing, traumatic brain injury. So hereafter I'm going to use the word TBI. So that is again a part of broad cognitive communication disorder, right? So that would result from external head trauma. So here what would happen is it would affect language presentation. So that can cause difficulty with organizing thoughts, leading to confusion and also disorganization in speech. And again, there can be word finding problems. If we talk about the cognitive link here, so TBI frequently affects attention, memory, and also executive functions, right? So that would indirectly but significantly impact a person's ability to communicate effectively in an effective manner, right? Even if the core language centers are less affected than in a typical stroke, right? So that is the cognitive link that you can see here. And if we refer to this most common one, dementia related language disorder. So here we see many old people, as in, aging parents and all these people kind of being affected by this malady a lot. So, when you consider these disorders, they involve progressive brain pathology. So, the nature of it would involve the progressive deterioration of language abilities. If you consider some examples, I'm pretty sure that you have heard about Alzheimer's disease, right? And also primary progressive aphasia. So, the changes seen in these maladies, these diseases you can include, right? So PPA, again, primary progressive aphasia, is a neurodegenerative syndrome where the only or most prominent initial defect would be language, right? And here this would manifest as a gradual decline in naming, comprehension, and overall communication. It is related to memory, and you can say anyway, memory and language comprehension, as in memory and the way that we use language, those are interrelated, right? Yeah. And if we consider about all these, yeah, other acquired conditions, again, you can see, right? Brain tumors. So, brain tumors and also infections like meningitis and encephalitis, they can also create all these issues related to language comprehension, right? So, it can be when you are kind of, diagnosed with an infection like this, it can affect your brain, your memory power, and then the way that you use language, and also neurodegenerative diseases like Parkinson's. Again, maybe you have seen some aged, I would say, individuals with all these trembling hands, hands with a tremor, right? So there you can see. And if we consider the key differences from developmental disorders, as in what are the key differences between developmental disorders and acquired disorders, right? Again, we need to be very clear on this. So, the change is characterized by a sudden or gradual loss of previously acquired skills, right? So, when you contrast it with DLD, in DLD, what happens? There is this failure to acquire skills, as in starting from birth, but this is not like that. Either it is a sudden loss, right? When you consider a brain injury, stroke, something like that, that can be sudden. And then gradual loss, when you consider something like Alzheimer and all, that would be a gradual loss that happens by step, not an overnight change, right? Overnight loss, a gradual loss of previously acquired skills. And if you consider the recovery pattern, so acquired disorders have different patterns of recovery, right? So let's consider someone who and through a stroke, right? So often this would involve a period of intense rehabilitation, right? Yeah. And when you consider DLD, right? So that happens as in it is not something acquired, right? So that literal develops from birth. And then cognitive impairment. So they frequently involve other cognitive impairments like memory, executive function, right? That would directly affect communication. That means there is another cognitive impairment as well. So when you consider Alzheimer, what happens? Dementia, what happens? It affects memory, right? When it affects memory, what happens? Then it would again affect language. And then treatment goal. So treatment focuses on rehabilitation, as in relearning skills, and also teaching comprehension strategies to manage the, I would say, all these defects. Yes, so there you can see. And if we consider the assessment and treatment, or as in what are the common assessment tools, how can you assess this, how can you diagnose, right? Because effective management of these diseases, that would require specialized assessment and also a comprehensive intervention plan. So if you consider all these common assessment tools, right? So assessment aims to identify the specific nature and also severity of the language impairment. When you consider standardized language tests, right? Like a formal norm reference tools can be used to measure specific language domains like vocabulary, syntax, comprehension against age matched peers. And then also observing communication skills during everyday activities that would provide contextually relevant data on how the individual uses language in a functional manner. And then also, as in parent and caregiver interviews, these can be used as in these would be essential for gathering developmental history, functional communication needs, and also understanding the impact of the disorder. Then, if we consider speech and language sampling, collecting and analyzing a person's spoken language, as in an hour long conversation or a story retell, right? So, these can be used as in to analyze grammar, complexity, and also communication effectiveness. And if we talk about, as the last slide, we are going to talk about intervention approaches, right? So, what are the intervention approaches? So, intervention again can be highly individualized based on the type and also severity of the disorder. So, there is this therapy called speech language therapy, which is known as SLP. So, SLP is the primary form of intervention. So, it can be either individual, as in one-on-one, or group therapy, and that would focus on specific goals like improving grammar, expanding vocabulary, or else practicing conversation skills. And also argumentative and alternative communication, that is called AAC. So that would provide communication support for individuals, I would say, whose speech is severely limited. And this can again range from simple picture boards, and also you can use like sophisticated voice output devices. All these can be used. And then family and caregiver language, I would say, education and support. That means teaching communication partners, as in how to modify their own language and communication skills to support the individual in the best possible manner, right? as in this individual with disorders, how to support them in the best possible manner. And then also educational accommodations, as in for children and students. This involves providing necessary support in the classroom, can be extended time, simplified instruction, or even reading assistance. And then finally, you have cognitive communication therapy specifically for acquired disorders. So this targets underlying cognitive processes, can be attention, memory, and even organization, right? And that would be essential for effective and functional communication. Right. So that would be the end of our lesson about all these language disorders. Here, the most important thing that we need to remember is that there are two major types, DLD and also you have ALD. So you need to remember, right? DLD and ALD. So all of you need to remember that these two are the major types, and also compare and contrast both of these types and clearly understand the distinction between these two. All right, we'll call it a day then.